The cost of health care is our top story tonight. Thank you for joining us. I'm Alex Bell. In just a few days, Congress will leave town for the holidays without extending critical Affordable Care Act tax credits. Today, House Speaker Mike Johnson announced that he will not hold a vote to extend the affordable health care tax benefits. That means come January 1st, premiums for many of the 24 million Americans insured through the ACA are all but certain to double or in some cases quadruple, something Democrats tried to prevent, leading to the recent record-breaking government shutdown. Now, Mike Johnson today blaming Democrats for this.
Yes, there is a healthcare affordability problem in America. It's a very serious problem for almost every family. But it is an indisputable fact that the Democrats caused that problem, and Republicans are the ones having to clean it up.
Congressman Mike Thompson, who represents California's 4th District, responded to Johnson's announcement, saying in part, quote, American families are being squeezed by higher grocery prices, utility bills, and even soaring costs for holiday gifts. Now, Speaker Johnson has announced that he's delivering the policy equivalent of a sack of coal for Christmas. He goes on to say Republicans' leadership's refusal to work across the aisle to extend these credits means millions of families will pay double for their health care premiums next year. This isn't just bad policy. He says it's cruel. The American people deserve better. I want to bring in ABC 10's Becca Habegger, who's joining us on how this will impact Californians and why rising healthcare costs are affecting more than just those on covered California. Becca, what did you find today?
Well, the Affordable Care Act subsidies, also referred to as tax credits, went into effect in 2021 as part of COVID-19 relief package, the American Rescue Plan Act. Now, it made coverage cheaper and expanded eligibility, but now the expiration of those tax credits is expected to have a significant impact on the cost of health care.
As a result of the subsidies, which have been in place since 2021, enrollment in ACA plans called Covered California here more than doubled nationwide, from about 12 million people before the subsidies to this year more than 24 million, nearly 2 million of whom are Californians. Now, if those subsidies expire after this year, as they're currently set to do, ACA enrollees could be paying next year, on average, more than double what they're paying this year.
Nationwide, we estimate that the increase in how much people pay on a monthly basis will be increasing by 114%, or $1,000 on an annual basis. So this is a lot for people.
Matthew McGough is a policy analyst at KFF for the program on the ACA. KFF is an independent source for health policy research, polling, and journalism. He says it's not as simple as just going back to pre-subsidy costs.
Insurers are increasing premiums by about 4 or 5 percentage points more than they otherwise would. And that's because insurers are expecting that a lot of people will decide to assume the risk of no longer having health insurance, become uninsured, and leave a relatively sicker, higher cost pool of people that they are going to have to cover.
Plus, he says it's not just ACA plans that are going up.
The employer-sponsored insurance market, as well as for small businesses, they are seeing some of the highest increases in how much they have to pay for health insurance that they've seen in a very long time. And this has really been driven by medical inflation, as well as a lot of policy uncertainty that's happening in Washington. Tariffs are having downstream effects, and a lot of insurers are building in the potential increase in how much they have to pay for different medical devices and pharmaceuticals in premiums.
Dana Fleischman knows this firsthand.
And this just really makes it difficult to do business in Sacramento.
He is co-owner and general manager of a gym in Sacramento, which offers health care to its full-time staff.
Typically, we see an increase yearly of 8 to 10% the past few years. This year, we got a letter in the mail, and it's going up 22%. It's an unsustainable increase if this is happening year over year.
So whether you get your health insurance through Covered California or the private market, there's a chance you'll be paying more next year.
Consumers are the ones footing the bill of this uncertainty. Insurers have to build in and pad their premiums if there is any policy uncertainty, because they want to make sure they're not putting themselves up for financial risk.
I reached out to Covered California for this story. The executive director was traveling and unable for an interview, but a spokesperson replied with a substantial and informative email saying, in part, we've heard stories of real people who are weighing whether to get or keep their health insurance if premiums are too expensive. There's still time for Congress to act to extend the enhanced premium tax credits and give American families support, stability, and access to the health insurance coverage they deserve. We encourage everyone to visit coveredca.com to explore their options and see what kinds of financial assistance they may qualify for. Alex?